Well, I had actually fallen and dislocated my shoulder, tore out my rotator cuff, and tore out bone as the rotator cuff came out. My husband is disabled, and so he was unable to walk, unable to take care of himself, and then the next month, here I go and get hurt and am incapacitated as well. And so it was very important for me to be able to heal, to be able to function, to be able to regain all of the use that I needed for my arm and my shoulder.
Whenever she had her follow-up visit with her doctor, she was the one who demanded that she get therapy because she knew in her mind that she wasn't motivated enough to do what she needed to do because of the pain. And so she came here and she was one of my patients. I am an occupational therapist, certified hand therapist as well. So my job here is to work on the upper extremity. It can be the shoulder, elbow, wrist, hand, and basically working on trying to get those patients back to doing what they used to do with that extremity.
And there was a part of a chain link fence that was torn down, and I got caught up in it and tripped and fell and bent and broke my arm backwards behind me.
I have a very active lifestyle, and I wanted desperately to get back to the point that I needed to be at to be able to perform all the things that I'm responsible for.
You know, we did therapy with her, and I would say she got 90 to 95% of her motion back and is doing really, really well.
Of course, I was in a sling, and they put me in that sling for several weeks, and then after that, then they sent me over here to begin treatment.
So my job with him was to do rehabilitation to increase his range of motion and strength and just functional use of the left shoulder.
I just immediately felt like I was at the right place, and that Tanya was kind and patient and funny and just made me feel really good. She just made me feel like I could accomplish my goals. I could get back to the point that I wanted to be at and have success, and I did.
The doctors said they were amazed that I have the usage of my arm because of the break. They didn't think I would ever get the motion and things that I've got now.
East Texas Treatment Center is a nonprofit organization, and they are so special. I just don't think it gets any better than East Texas Treatment Center.
I had a child tell me about 2 weeks ago. I asked him if he was looking forward to school starting, and he said no. And I said, what's the worst part of your day at school? And he said, recess, which for any other kid is the best time of day. And I asked him why that was, and he said, nobody will play with me. And I asked him why for that, and he said, because they can't understand me. So anybody that their communication level is lagging behind for whatever reason, whether it be physical, something that's induced like an injury, they would all be good candidates for speech therapy. The point of all the speech therapy is that you blend in with everybody else and that other people are not questioning you about what you said. It's such a feeling of accomplishment and pure joy for that patient that they're getting back to normal, that they get that part of their life back, their communication, because communication is really what we have that's so basic and so needy. And for them to get that back, that makes my day every day.
I had a heart attack 3 years ago, and I felt that it was time for me to get off the couch and get to doing exercise, and that's the reason I'm here.
Bypass heart surgery in 1983. Told me I had an expectancy of about 10 years out of it.
Well, that actually was my second open heart surgery. I had another one in 1989. And East Texas Treatment Center was where I've been rehabilitation both times. The treatment center has caring people here. They're very careful on who they hire and employ. Being from Kilgore, I hear a lot of good compliments on it.
They were just amazed at the progress I had made and how well I was doing and how well my cardiac checkups went.
They have an excellent, wonderful staff here. They're dedicated people, they're knowledgeable people, and they're really good to be around. My family has been very involved in my health, and they've always wanted me to stay active, and this is the best place for me.
It's an overwhelming concern in your family and your wife and your kids and the entire family. It's a traumatic thing to go through. And once you go through the operation, you want to know that where you go and you do your rehab, you have people that care and they have the facilities.
The staff is very well qualified. They're very interested in our health. Real good program that I'm pleased and I hope I can continue on for a number of years.
The doctors are real happy that things have stayed as they were, and they're just tickled to death about it.
After that, I was just like, I hope I don't die, really, to be honest with you. Well, see, they dropped a piece of equipment on top of me, and it fell on top of me, and it broke my leg, and my leg snapped and twisted around the rest of my leg, and I was laying on top of it, and it broke my back and all of that, too, so... when I caught my breath, it was just, pray to the Lord, you know what I mean? Please save me from my daughter. I have a daughter and a girl at the house, so I had to get home to them, but.
I'm a physical therapist at the East Texas Treatment Center. I have a doctor of physical therapy. I'm also a certified lymphedema therapist. We offer physical therapy services, including rehabilitation for sports injuries. We offer lymphedema therapy with complete decongestive therapy. We can custom fit compression garments for physical therapy or other venous insufficiency problems. We offer Graston, which is instrumented soft tissue mobilization. We can improve outcomes as far as improving return to sports time and improving outcomes overall, or return to activity times.
If Jeremy hadn't gotten treatment, he would most likely would have been had a very difficult recovery if he hadn't come to physical therapy, just based on his low activity level from his injuries.
It's pretty hard, man. Trying to have a little girl and not being able to play with her all the time, and just plain and simple, she wants me to pick her up. She's saying, Daddy, pick me up, and you can't.
Jeremy's recovery went really well. He worked hard, and we helped him improve his strength and range of motion and function to get him back to where he's at a competitive level in his work.
It's like having a friend right beside you at all times. That's just simply how it is. So, it's good.